So I'm a board certified psychiatrist and I've helped over 170 PMHNPs gain clinical confidence in their psychiatric diagnosis skills, treatment skills, and actually being able to help patients get better. So this video, we're going to be covering sweating and SSRIs. So I'm going to teach you how exactly as a provider you can manage the side effect of sweating or hyperhidrosis in your patients so that way your patients can actually stick with their medication and actually get better. So I'll walk you through the framework that I use whenever I'm working with a patient and I'm trying to assess for their sweating and what I do to help treat it. So the first thing that we got to understand is the most common complaint that patients will have is that they will complain that they have night sweats. Basically, they'll take their medication, they wake up the next day and they are just drenched. Their sheets are drenched, they are drenched, they feel super warm and they're not really sure why. And it's a common thing with SSRIs and SNRIs, so there's two reasons for it. So one is that serotonin will mess up the thermoregulation. So serotonin will decrease thermoregulation. So because serotonin does this, then it can lead to some people having that sweating so that their bodies may perceive that they are hotter or warmer than they are. And so they sweat to cool down. And so that's where that comes in. But then there's also with norepinephrine. So norepinephrine increases the sympathetic nervous system. So think about norepinephrine like your fight or flight nervous system. And so with this, imagine you're running away from a bear. Your sympathetic nervous system is super jacked up and you sweat a lot during that time or during an athletic endeavor to cool your body down so it can sustain itself for that exertion. So if you have an SNRI like venlafaxine or duloxetine, then those can cause the sweating. So what do we do about it, right? So the first thing that we got to do is ask ourselves, is it the SSRI/SNRI? Because a whole bunch of other factors could be contributing to the sweating too. Menopause, thyroid issues, stress, anxiety, panic. There's so many other things, infections, withdrawal. There's so many other medical things that could be contributing. So you want to just make sure that it's actually the SSRI. Because let's say you take them off of it and now the sweating's still happening. Great, like now the patient's been set back a couple weeks or a month from their treatment. And we know that SSRIs take a while to build up. So that's the first thing you want to check. In most cases, it probably will be the SSRI or SNRI because the patient will say, I wasn't sweating before and then I started this med and now I'm sweating. Okay, but you just want to make sure that you check that. So two, now what we have that, right? That the first thing, okay, what can we do to address this? I mean, the easiest thing is to wait or decrease the dose. So I had this patient, he was on duloxetine, 60 milligrams for pain and also for anxiety, depression. And so for him, he came back and, he said that he was waking up and he was just drenched in sweat. But he never mentioned it because he didn't think it was related to the medication. Like he just thought that it was happening for X or Y reason. He thought it was because of stress or something, but it just never went away. And so I was like, okay, when did this start? And it started a couple months ago. And I was like, that's when we increased the duloxetine from 40 to 60. So I was like, okay, well, why don't we go back down on dose? Let's go back down to 40 and see. And so we went back down to 40. And the next visit, he tells me, hey, that sweating has gone away completely. And because now it had been enough time that he'd been on the duloxetine, it was getting him a good stable benefit for his anxiety and depression. So that worked out really, really well. Other times, sometimes the effect can be at the beginning because that's when it's the worst. I've had patients where I've just said, hey, we're just starting out. Do you want to continue? Do you want to get off? And they were like, okay, no, I want to continue. I really want treatment. So I said, okay, let's just wait it out for a couple of weeks and see what happens. And most cases, the waiting it out is what helps the patient. So that's the key with most side effects too, but especially with the sweating. So now for number 3, there's so many non-pharmacologic things that we can do to help the patient, like lifestyle stuff. So for example, cooling, So this can be like air conditioning, ice packs, fans. Just making sure that the room is cool, that the environment is cool, is the easiest thing that you can do to help with the sweating. Like maybe you just need a lower temperature now than you did beforehand to be able to fall asleep. Cool showers. So I'll say showers here as well too. Other thing is cotton sheets. You want something that will absorb the sweat pretty well and is comfortable. Like you don't want some kind of polyester or silk, because that is not going to absorb the sweat nearly as well as the cotton would. Avoiding caffeine or alcohol. So these are a lot of common, and spicy foods. These are a lot of common things that people take. Caffeine during the day, and hell, like espresso martinis and things in the evening, or just, like nightcaps or whatever. So caffeine, alcohol, big thing. Spicy foods. I mean, this stuff in general will just help their mental health. I mean, especially these first two. But avoiding all that stuff can make a noticeable difference for the sweating. Decreasing stress. And so doing natural things for stress reduction, like meditation, journaling, all of this stuff can help decrease the sympathetic response that people are having from the stress, decreasing the cortisol. And then when you do that, that can help out the sweating as well too. So yeah, meditation, CBT as well. And so yeah, and then sleep hygiene too. So making sure that their sleep is as good as possible. Because if people aren't getting good sleep, then they get more stress, then all of that leads to this. Okay, so now let's say we're doing some of the lifestyle stuff and it's not working or it's not fast enough, then what do? Then we can go to supplements. And people like supplements because they tend to be better tolerated, they're more holistic, less intense, and then you're also starting a med to counteract another med, which is not ideal. So there's supplements, and basically we want to get the most calming supplements for the autonomic nervous system. So number one is magnesium glycinate. So this before bedtime can be super, super helpful, but during the day as well. L-theanine. L-theanine calms down the sympathetic nervous system. It releases alpha waves in the brain, which are very relaxing. And so this can be a potent combo to give at nighttime too, before the sweating, to really help a lot with that stress response. Ashwagandha works more long-term, but it helps decrease the cortisol response that people have. So by decreasing the cortisol response, then you help out the sweating. B vitamins. Many patients tend to be deficient in B vitamins, and so that messes up their production of serotonin and norepinephrine and things. So just having a good B vitamin level, like B6, B12, homocysteine, methylmethylonic acid, can be very helpful as well too. Sage is another one. Yeah, so sage has some anticholinergic effects actually. And so because of the sage, then that can help that as well. So this is what I like to go to, especially if the sweating is more mild and tolerable, but still annoying. And then what we get to are pharmacologic interventions. And so there's a couple that I really like in this one. So one of my favorites is propranolol. And propranolol helps to decrease the sympathetic activity of the body. So we use it for performance anxiety because it helps people, like calms down the heart rate, calms down tremors, basically just physical relaxation. And so that can be a great way for sweating as well too. It's a blood pressure med, but then by taking it before nighttime, you limit the risk of falls and things like lightheadedness, and that can also incidentally help people sleep. So win-win. But if you want to target the anticholinergic activity in more detail, because remember, like cholinergic activity, that's what promotes hot and sweating, and so anticholinergic promotes more dryness. So you can do oxybutynin or benztropine. In psychiatry, we use mostly benztropine. We don't use oxybutynin, like urologists use that one a lot because it's more bladder specific, but you can use it if you want to use it for cholinergic. I'll do the benztropine and the propranolol, but another really good one, especially in psych, is clonidine. And clonidine helps to decrease the sympathetic nervous system. So alpha-2 agonist basically cuts off sympathetic activity, and so that can be very helpful for the sweating as well, especially at nighttime. If it's more daytime sweating, then you could do guanfacine, just because guanfacine is less sedating than the clonidine is. There's also glycopyrrolate. And so this one is really helpful, for example, with clozapine and like other things that cause a lot of saliva. We use this to help counteract that. But so that dryness that it promotes, it can also be helpful for the sweating side of things too. So those are the main things that we use pharmacologic wise. And this is the hierarchy that I like to go down when I think about, okay, if a patient's having SSRI sweating, how I work them up for it, and then how I consequentially treat them. So if you want to really learn more stuff like this, how to manage weight gain in psychiatric patients, how to deal with other side effects, how to dose medications properly, how to titrate them, how to deal with complex cases, really just learning the fundamentals and the in-depth psychiatry from a board-certified psychiatrist. Best way to do that is part of our PMHNP coaching academy. We've had over 170 students go through so far, and they're really getting good value from it, becoming more confident, more capable clinicians. So you can check that out, and otherwise, we'll see you in the next video.